Asthma. Right medication, right way. Well-controlled asthma doesn't have any symptoms. We can help you achieve this by giving the right medication in the right way. To help you manage your asthma, your doctor or nurse may recommend trying a different inhaler. Many people find it hard to take two inhalers. A new single inhaler that works as a preventer and a reliever may be a good option for you. This is a single inhaler, a maintenance and reliever therapy inhaler, often called MART. MART inhalers can come in different shapes and sizes, but are often red or pink in colour. A MART inhaler can be used when you have symptoms instead of your blue inhaler, and can also be used every day as your preventer inhaler. It works as fast as your blue inhaler. Clinical trials have shown benefits of single MART inhalers are: they give relief from symptoms, prevent future symptoms, are more convenient, reduce the risk of asthma attacks, and are better for the environment. Prepare and prevent is best. Many people will only find relief and gain good control over their asthma by using daily preventer medicine. We might suggest a switch to a MART inhaler, which contains both your preventer medicine and fast-acting reliever in one inhaler. When you are well, your airways are nice and open. When unwell, your airways narrow, making you breathless. Preventing the airways from narrowing will keep your lungs healthy. When you have symptoms from your asthma, this means your lungs are inflamed. Your blue inhaler does not treat inflammation. While your blue inhaler might make your symptoms feel better for a short time, it's like a bandage. It hides the problem but doesn't heal the injury. Preventer medicine, however, reduces inflammation and stops future symptoms. A MART or combined inhaler can heal your lungs and provide relief. And inhaled steroids are safe. People are often concerned about taking regular steroids. Asthma is a long-term condition that needs long-term treatment. Inhaled steroids are not addictive. The dose of inhaled steroids is very low. They go straight to your lungs without affecting the rest of your body. Taking a preventer or a MART inhaler to control your asthma reduces symptoms, decreases the risk of hospital admissions, decreases the need for additional medication. How you take your inhaler and getting the right inhaler for you is as important as the medication inside it. Your healthcare professional may suggest a different style of inhaler that suits the way you naturally breathe in when taking an inhaler. People tend to use inhalers in one of two ways. Most people breathe in quickly and deeply. This suits a dry powder inhaler. Others breathe slowly and steadily. This suits a pressurized inhaler. If you breathe quickly and deeply, you'll need a device where medication flows slower, as it must travel from your mouth to your lungs. But powder inhalers won't work if you breathe too slowly. For slow and steady breathers, pressurized inhalers are ideal as they push the medication into your lungs. But pressurized inhalers won't work if you breathe too fast. To help you manage your asthma, your doctor or nurse will assess how you take an inhaler and may recommend trying a different inhaler device. The right medication for most people is something to keep your lungs healthy, something to take if you get symptoms, and if you only take a blue reliever, the recommendation is now to take newer inhalers to help with your asthma. After an asthma attack, we recommend seeing your GP or asthma nurse within 4 weeks. This is to assess your symptoms, check you are improving, review your medication, and refer you to an asthma specialist if needed. This is also your opportunity to discuss recent symptoms, reassess your asthma management, and review your medication. Good asthma care includes stopping smoking, a personalised asthma plan, regular asthma reviews, the best inhalers. Your healthcare professional will recommend the right inhaler for you. By using the right medication in the right way, you're more likely to achieve well-controlled asthma with no symptoms. Remember, well-controlled asthma doesn't have any symptoms. This is what we are aiming to achieve.